very valuable because partnerships is key for sure.
Excellent. I was just going to add, I think we need to look a little bit more at sort of that emerging field of collective impact. And what I liked about it, there's lots of literature, and there's a bit of a system, and they talk about some sort of an organizational infrastructure to support it. But what I like about the collective impact is that it kind of varies the traditional type of a partnership, where organizations are all working sort of to achieve an end, but they all have sort of their own components. And often their own reasons for being around the table, and that's okay. But it's just they're really trying to make a difference in one area. It's not like there's one project that everyone is owning and contributing to. You're still doing your work, but it's leading to an end goal. So I think there's some area looking at our partnerships just a little bit differently going forward.
Actually, my name's Michelle, and I'm just going to say the same thing, but I didn't want to go sit down. Something I've been thinking about a lot. A lot of the collaboration is still about meeting your mandate and your funders, and I mean this in a positive way. It's around tinkering around the edges, but bigger system change does involve at times thinking about collective impact. And I think there's a lot of interesting writing, particularly coming out of Stanford on it. And that's what's on my mind these days. Collective impact may mean that organizations need to really revisit their missions. Because when you work together differently, and you all consider your contribution to a bigger effort might change. And I know some of the philanthropies, I think that's where a lot of it started from, that rather than give in the U.S., which is a different model, rather than give money to individual programs in a community or on an issue, figure out what's the higher level desired outcome, get people to work on it. But it changes the dynamics, and that's part of I think the challenge. A lot of the social innovation is sort of new ideas arising that are coexisting with existing initiatives. But if we want to bring everybody together, how will that change what individual programs do? I don't have an answer, but I think we need to follow what the impact is of that over time and how well it's working.
Yeah, one of the ways that I think about the kind of building the local networks and the collective impact and so on is making the connections. And so if we're working away on whatever it is, a project to reform a very specific area of service provision, or to build a coalition of support around HIV prevention and health promotion in a particular area that builds new coalitions together. I think a neat way to always think of it is we're working on whatever it is, whatever that specific issue is, but simultaneously we're trying to make connections to the bigger picture. So we're maybe showing, all right, we're working on healthy child eating, but of course poverty is such a crucial driver of it's not just you don't know to eat your greens, it's you can't eat your greens, or there aren't any greens in your neighborhood. So making those kind of connections, and maybe you're at another the Anti-Poverty Coalition, as well as the Healthy Kids Eating Coalition. So it's that kind of, and I think that the example that Tanya gave of getting the BPA out of baby bottles was in fact such a driver for getting the BPA out of everything. And so to me that's a nice example of kind of strategic opportunism. Hardly anybody's in favor of poisoning kids. So we're all working, we all know the importance of kind of, to get a little academic, the life course perspective on social determinants of health. And the research is absolutely indisputable on the importance of investing in kids' health. But also kids are nice sort of poster babies for change, and it's a more palatable way to drive change. Well, all right, so what? It doesn't mean we accept that kind of constraint, but let's build on it. Let's use what kind of levers, what kind of openings we have to drive the big picture change too.
I just want to go back a little bit to the previous speaker. I work in International Women's League, and I'm more than happy
have a conversation with you about how it can be funded. We actually get a week funded every year around that subject in Kingston. One of the points that I wanted to bring about partnerships and collaborations, which has been really useful. I'm part of the Social Planning Council and a number of feminist organizations and immigrant organizations in Kingston, is to have that partnership open with service users and with clients, and really with people utilizing your services. For a lot of non-profits, when I first got to Kingston, very few service users and clients were sitting on board of directors, and we found that to really be able to speed up the work that we were doing, to have somebody sit on our board. We do that with Kingston Mental Health and many other agencies in our community, and I really found that one step has gotten us, often 4 or 5 steps ahead.
I think if the communities are part of a solution or if part of a movement, then it becomes very easy. That's what Tanya was talking about. That once, if you wanted to raise money, there were 60 people or 50 people who were willing to invest money because I'm sure that 6 years she built those relationships and all, and people believed in what she was doing. So that's exactly sometimes is missing, where we don't trust that either there is no that connection or partnership with the local community, or there is a disconnect where organizations are building solutions which does not really engage other than some early conversation with the community. Then you go back, you totally build a solution, and by the time community knows, you just had one conversation with them to take an input, and after that there is no connection. So I think there has to be a meaningful collaboration with the community and be part of it from the start to implementation to the end, so that I think that is what's needed, and I think that's what you are just pointing out in your review.
Let's do a quick little poll. How many of you work in service provision? A service providing organization, a CHC or whatever, public health. How many of your organizations, keep your hands up for a moment, how many of your organizations have a community advisory panel or some kind of institutionalized form of community input? A lot of those hands went down, so there's an idea to take that home. How many of your community advisory boards, panels, whatever they are, have some power in the sense that they've got some budget, they've got some money they can use, or they have a requirement maybe from management to respond to their suggestions? Maybe put those hands up. Not too many, or to be a little more quantitative, no. So there's an idea to take home, right? LHINs, hospitals, many healthcare providers are mandated to do community engagement. So let's think of how to give that some traction, to make sure there's a whole range of voices involved in that engagement, and to give it some traction with some resources. Doesn't have to be a huge amount of money, but just imagine if a small proportion of discretionary LHIN funding or hospital funding could go to those maybe little $1,000 pots that Tanya was mentioning, and the Toronto Central LHIN has just agreed to this, so this is excellent progress. Went to whatever came up from those community members, and they're hopefully in touch with their constituents. So there's an idea to take home too. Forgive me, I believe you are.
Thanks. Hi, my name is Mary Catherine Lehan, and as a planner, what I'd really like to see is our various professional organizations offering, we do lots of internal social activities, but I'd like to see our professional organizations collaborate to offer social events for different professions to attend. Planners, architects, engineers, community health, and maybe we could rent space at CSI to have a little party.
Okay.
Hi, I work for a health charity, and I was brought in to revitalize our programming, partly because we just don't have the money we used to have, things are being done differently, and I've been struggling to engage and convince a lot of our volunteers and stakeholders that this partnerships are a really good thing. And I turn around and I have our fundraising department saying, well, you can't work with them because they're competitors, or I'm trying to work with health charities, and they're saying, well, partner with you, but we have to do it quietly, because once it gets too high up the chain, we can't, you're our competitor, or, looking at people on prevention, and I'm trying to get us involved at the policy making boards and the coalitions and things like that, but I get a lot of pushback because if we're not actually doing the service, it's really hard for some of our board members and volunteers to see the value in it. They say, well, you're just sitting in meetings. You know, and I'm really struggling to say, well, we don't have the money or resources to do the prevention ourselves. We should be doing it with this group. So it's really hard to sell some of these partnerships and participation coalitions with other, with some of our stakeholders. I just wondering if anyone had any feedback on how I can do that.
Can I answer? So this is where I give you some example of human endeavor, and I think this is something, if I can bring a value, and I think other people can bring value, is share their experiences where you can learn. So you're saying you don't have money. So the same as small organization, we have the same issue. So we thought about it and we said, why don't we set up our own social enterprises where we involve community members, immigrants, marginalized, help them use human endeavor office space, which is sort of city-sponsored space at this point, and let them do the business. So we have a number of businesses, including from like very high-tech game, computerized game making, to app development, to very simple cushion making by new immigrant senior women, right, which we sell through our online mall and everything. So in 2011, we sold our first product in June time for $100. Like that was the first income that we generated with that. And last year we had around $80,000 revenue from our social enterprise. This year we are targeting around $120,000. So it's kind of a small step, but if you take at the 30% margin that we want to keep, it gives us $30,000, $40,000 per year to do something. So with that, we actually just, with that investment, we started our Hope Adults Day program last year because there was a need in the community. Again, if you wait for Central Lane or somebody else to fund, it might take 5 years, or maybe even longer. Or maybe somebody else will get it and we will not be. But if we have seed money out of it, I think this is where I personally believe, and a lot of people you have to think is how to have seed money in your organization. And there are ways. You can just learn about it and start utilizing the community that's, in particularly the marginalized communities or immigrant communities or other individuals who are not contributing, bring them on, give them the opportunity, guide them, because you as an organization can have access to a lot of resources which they don't, and then take advantage of it. That's what Human Endeavor is doing. So just to give an example, the simple model that we had for our own organization, last year, we are now implementing in Georgina, which is a northern part of York region. So they are replicating our Epic incubator there. And we will get, as a franchisor, we will get 5% or some money coming to us, the way it normal works. But we are also sharing all our knowledge and everything with them. And next year, we are start implementing in Malta. Because again, we are empowering a particular organization or group of organizations. So the same way you can think about, and I think that's where, if you have your seed money, you have your, and when I earlier said about entrepreneurial thinking, that's not that every time there has to be money involved, it's just different way of thinking and doing things where you have nothing, so you don't have to wait for somebody to come and give you money, you can just create something for yourself from the resources that you have.
Okay. Not all partnerships are subtle in their messaging. So we do need to wrap up here pretty quickly. So that was Nora's last word. Barb's going to get a 15-second moment of fame for her last word, and then I get a 3-second moment of fame. So.
Okay, and I just want to thank the last participant for raising that fundamental question that actually often does not get talked about. And I think most of us have experienced that level of tension in our organizations from time to time, because our structures often do put us in a bit of a competitive mode, sometimes intentionally and sometimes unintentionally, that is a reality. So I'll probably see after. But my last parting words really are just something simple that I've been reading in terms of some of the social innovation pieces. But there's some questions that we, I think, need to keep in our mind. And one of them is, are there some things that we need to let go of? Brenda Zimmerman, who's one of the co-authors of Getting to Maybe, spoke at a leadership gala that we hosted last year. She really encouraged us as individuals and as organizations to let go of things from time to time, because we often have far too much in the air that we can't devote the time and energy to it. And some of these are huge issues, so choose carefully and choose wisely, and then, it's okay to let other things go. And then the other questions I would just encourage us to continue to resonate are, don't ask ourselves, are we doing things right, but are we doing the right things? And if we can try and keep focused on those right things, we will find those paths through the storm, going back to my sailor analogy, and we'll figure things out together.
And that's a nice rousing way to end. So here's a little idea from me. Each of us to think of one idea, or 20 if you will, on a project or anyway, an idea that can bring together a lot of the stuff we've been talking about. Ground up community innovation, driving a very specific, very concrete, very local action, but making the connections to wider partners, to wider issues. Here's mine: peer health ambassadors or health workers. A bunch of you from CHCs have got peer workers. How many people have got peer workers in their areas? Okay, so tell those stories at lunch to your others. What it basically means is folks from immigrant communities or from community of interest, lesbian, gay organizations, people living with HIV, people from a particular neighborhood, getting together to work with their peers to drive health and health promotion. All kinds of good research, all kinds of great potential, both for innovation but also for getting stuff down. So think of your best idea, share it at lunch. That would be the incentive that we're moving into here, because I think lunch is going on. So thanks to the panel. Are you going to do that? Thanks, guys.